Welcome everyone who's joined today's webinar. Thank you very, very much for being part of today's webinar. We appreciate your time. This is part of the Consumer Goods Forum learning series on health and wellness, and today's focus point will be on responsible marketing to children. I'm Sharon Bly. I'm Director of Health and Wellness here at the Consumer Goods Forum, and we'd love to make the best use of your time today and ensure this is an interactive session. So we'd love to have questions or comments that you may have on today's webinar. We'd very much welcome that at the end of the webinar. I'm delighted to introduce today's speaker, Ellen Wartella, who firstly is an absolute pleasure to work with and also an expert in her field. And Ellen is a leading scholar from Northwestern University and will bring us through her topic today on responsible marketing to children, and a topic that you will see she's very passionate about. In total, we have 45 minutes. The webinar is being recorded, so if your colleagues couldn't join today or there's other people who you think might be interested, you can please share the recording with them after the webinar. You're on mute on the call, and we can unmute phone lines at the end of the webinar if anyone would like to speak directly. Otherwise, you have a chat box on the right-hand side of your screen where you can ask questions to Ellen and myself. Otherwise, you can send me an email. You can see here on the screen. It's s.bligh@theconsumergoodsforum.com. Anything that comes to mind through the webinar, please feel free to send me those questions, and we'll either get to them directly at the end of the webinar or after we'll contact you directly. So what I'm going to touch upon today, the agenda, we'll give you just a little bit of context on the health and wellness pillar and how responsible marketing to children fits into our overall work here at the Consumer Goods Forum. We'll touch upon the commitments that we have made with our members of CGF, of Marketing Communications to Children. Ellen will then deep dive into the topic of food marketing and childhood obesity. And as we mentioned, we'd like to leave time at the end for Q&A. The Consumer Goods Forum, the work that we lead here on health and wellness is in an overall agenda for the consumer goods industry, which covers environmental and social sustainability, product safety, with notably our global food safety initiative, health and wellness, which is the area we will cover today, and end-to-end value chain and standards. And all of these areas are worked upon by about 1,500 executives from the member companies of the Consumer Goods Forum, and governed by a board of directors of 54 CEOs. And what's a little bit different about the CGF is that we're a parity-based organization, so everything we do is based around collaboration between retailers and manufacturers working together to find efficiency and to work towards positive change. So another one of our objectives is, of course, knowledge and best practice sharing, and that's one of the ambitions that we want to achieve today with this webinar. So where does responsible marketing to children fit within our overall health and wellness pillar framework? You'll see here our vision is empowered healthy consumers globally. We work on two major leadership projects. One is collaboration for healthier lives, and the other employee health and well-being. And three fundamental areas where we drive collaboration is on marketing communications to children, product formulation, and transparent consumer information. And all of this, we measure and report on our progress annually in our annual report, which some of you may have seen, and if not, I'd be happy to share it after the call. So the foundation for all of the work that we do is based on what we call resolutions and commitments. And when we started the collaborative work between the retailers and manufacturers of our organization, we had three areas where we wanted all of our companies to focus on. The first one was offering consumers and shoppers a range of products and services that support the goals of healthier diets and lifestyles. The second area was providing transparent and fact-based information to help those consumers. And the third area where we thought we could come together was using communication and education to raise awareness on health and wellness. Then in 2014, with the CEOs, we brought further focus to our program and our framework, and we made 4 public commitments, which we track and measure each year. The first one on product formulation, second one is on employee health and wellness, And the third area is on labeling and consumer information. And the fourth commitment that we made was on responsible marketing to children, and is the focus of today's webinar. The commitments, two of the dates have come to term in 2016, but by no means that doesn't mean that we're not continuing our work in these two areas, and they remain extremely important to our framework. And we will continue to measure and report on how we're doing on reformulation and employee health and wellness. The commitment that we made and that we're looking to drive implementation across the retailer and manufacturer members of the CGF. You can see it here on your screen. We've given ourselves a date of 2018, and we are really, between now and the end of 2018, looking to share good practices, best practices, implementation details between the retailer and manufacturers members of the CGF, and how we can accelerate implementation of this commitment. And we have an implementation guidelines which is available on our website if you're interested in looking at that. So now what I'll do is I'll hand you over to Ellen to bring us into the main focus of today's webinar, which is food marketing and childhood obesity. So Ellen, over to you, and a big thank you for taking us through this agenda.
Thank you so much, Sharon, and thank you everyone for being here today. I'm delighted to have an opportunity to talk to you about what is clearly a topic of interest to CGF and interest to families around the world, I would think. Next slide, please. I'm going to talk about a few things. First, I'll lay out a little bit of what we know about the childhood obesity crisis, primarily in the US, but also internationally. I want to talk a little bit about children's nutrition and what we know that's important to provide good nutrition to children. I'll talk about the marketing environment. I won't bore you a great deal about this, but the marketing environment is sincerely changing out there for kids and for adults alike. And then I want to review for you two U.S. Institute of Medicine, now called the National Academy of Medicine, studies on food marketing and childhood obesity. There are one from 2006 and the more recent one from 2012. And then I'd like to give you a sense of where I think we are now with this issue of food marketing and obesity. Next slide, please. Overall, about 1/3 of American children and 2/3 of adults in the U.S. are obese or overweight. There was an article in the New York Times on Sunday that suggests that this is not just an American problem. They estimate from, I believe it's UN data, that 700 million people worldwide are obese, and of those, about 108 million are children. More striking and more frightening was the fact that they report that prevalence of obesity has doubled in 73 countries of the world since 1980. So obesity, and particular childhood obesity, is a global issue. Next slide, please. And what we know about obesity is that it has enormous health consequences. It brings on diabetes. We know that an estimate in the United States of about 11% of adults have type 2 diabetes. And more alarming is that 37% of adults are considered pre-diabetic. Even more worrisome is that we know that there is an increase of children being born today who will develop type 2 diabetes in their lifetime. In particular, this seems to be striking Latino and African American children. Next slide, please. Obesity has a number of other health problems. It's connected with cardiovascular disease, high blood pressure, sleep apnea, depression. There are health consequences to being obese. And we know that there are a number of psychosocial issues, particularly with children, that it stigmatizes them, it leads to low self-esteem. And there's some suggestion that obese children and adolescents and young adults have functional problems in the society. They tend to have reduced productivity at work, and that such obesity is associated with unemployment. Next slide, please. These health consequences, in turn, have costs to the society, and I mean money costs. It's estimated that that obesity is costing the U.S. an estimated $190 billion in obesity-related illnesses, and that obesity is associated with about 20% of all healthcare spending in the U.S. Also, it's estimated that the loss as a consequence of obesity is about $4.3 billion to businesses and absenteeism on a yearly basis. All right, causes of high rates of obesity. May I have the next slide, please? It's pretty clear that obesity can be traced to trends both in environmental influences on physical activity and food intake. The major problem is that we take in more calories than we expend. Next slide. And one of the reasons for children in particular in this reduced physical activity is that they're spending much more time with media, and in particular in not moving around. Also, what we know is that there's an overall assessment of the eating and dietary patterns of children that is quite problematic. They're not eating what they should be eating. Higher than recommended sugar, sodium, fats, inadequate intakes of whole grains, fruits, milks, vegetables, and a general increase in calories and carbohydrates, and sweetened beverage consumption, as well as away from home foods. All of this is leading to eating more, and as I said, children are watching television, using their iPads and their cell phones, and they're moving less. Next slide, please. In this overall mix of lifestyle, there has been assessments of the role of food marketing, both its impact on the choices that children make for foods and its impact on the environment of foods available to children. The U.S. Institute of Medicine, now called the National Academy of Medicine, has conducted two major studies to examine this childhood obesity crisis. One was in 2005-2006, when they convened a special study group to examine the role of food marketing in the obesity crisis. This was called for in a 2004 study that outlined the overall increase in childhood obesity. And that 2004 study group asked for a special group to just look at food marketing. And that report was called Food Marketing in the Diets of Children and Youth. 6 years later, another study group was convened to look at how we were doing in the U.S. in advancing obesity prevention. And that 2012 study looked again at the issue of food marketing's role. Next slide, please. When we talk about food marketing, we're talking about a variety of marketing strategies, many venues, schools, grocery stores, theaters, sporting events, childcare settings. Many media vehicles, and this is being added to all the time. Originally, we were most concerned about TV advertising, but there's also print, web, advertisements within video games, push advertising on cell phones, available in apps, and an increasing group of experiential marketing events that also are marketing strategies. And there was specific concern about school-based marketing practices in terms of what kinds of products are sold in schools, and direct and indirect advertising, such as the wearing of brand names on athletic wear in schools. Next slide, please. More recently, what we're seeing is an increase of new types of marketing practices, company websites, advertising on third-party websites. Indeed, there's been a lot of talk in recent days about what kinds of advertising has been going on Facebook, for instance. Advertising within video games and DVDs and interactive games online. In examining the websites in particular, what we're learning is that websites today are no longer static, but are very dynamic, presenting all kinds of very involving ways for children to engage with the games on those websites, and frequently those games are using products such as collecting different kinds of cookies or collecting other food products as part of the actual interaction that the children are having with these games. And apps are a new means of engaging children in games that focus oftentimes on media characters associated with foods and beverages. A number of brands are increasingly using these more digital marketing practices, and there's a good reason for that. Most recent data that I've seen from Nielsen suggests that the audience for children's television, on television, is half the audience today than it was even 10 years ago. Children are moving away from watching television through television sets and moving to other ways of accessing entertainment. And YouTube is a prime example of that, but it's other ways as well. And as this movement of children's eyes and ears and hands and their variety of involvement changes with media, clearly marketing practices are following along. Next slide, please. In fact, some of the newer marketing techniques are responsive to this changing nature of children's use of media. What we're finding is that food and beverage companies routinely are using some of these digital marketing practices. Immersive techniques such as augmented reality or online gaming or virtual environments, where you can reduce young people's conscious attention to marketing, and where you may be able to induce their greater involvement with the product and the brand. Social media monitors users' online behaviors without notification as well, such as through viral brand promotion. Whenever food and beverage marketers are using social media such as Facebook or Twitter or YouTube to foster an ongoing engagement with young people, that encourages the young people themselves to send on, it's called the viral effect, to send on the products or the information they have about products that they like to their friends, and to send it out as an extension of the marketer's message. We also know that there's all kinds of data collection and big data sets to analyze users' online behavior, to know what websites youth are going to, what products they like or they discuss online and at social media sites, in order to develop a better profile of how to reach these young consumers. Location-targeted marketing involves following people as they move around to link geographic locations with point-of-purchase decisions for branded foods and beverages. If you're in the mall and you're walking close to a particular kind of fast food restaurant, you can send a note and ding people to let them know that there's a special that day, or that they're coming up on a place where they can buy some foods. Also, there's some suggestions that neuroscience is being used to develop digital marketing to trigger emotional and arousal influences to brand preferences. All of these techniques are thought to be especially effective techniques for children and adolescents. And quite clearly, these go far beyond the Saturday morning commercials of 30, 40, or even 50 years ago. It's a new Wild West marketing environment. Next slide, please. So what sorts of foods are being marketed to children and adolescents? The best evidence we have is that the foods that are being marketed are not foods that are representative of the best sorts of diets. They tend to be high in sugars, fat, sodium, and calories, low in the nutrients that children and youth need, and low in fruits, vegetables, whole grains, and dairy products. So what kind of effect does this food marketing have on children? Next slide, please. There was an evidence review in 2006 to look at what we know about the impact of children's food choices and the marketing of these kinds of products on their food choices. This was the 2006 Institute of Medicine report that gathered a variety of articles and scientific literature, went through the trade journals as well as industry journals. And the committee itself included members of the food and beverage industry, as well as pediatricians and nutritionists and people who study children and media like myself. I was a member of that 2006 study. Next slide, please. The study concluded after a year's worth of work and hearings and reviewing all the evidence that they found strong evidence at that time for TV advertising's influence on the food and beverage preferences, purchase requests, and the short-term consumption for 2 to 11-year-old children. They found slightly less strong evidence that food marketing on television was influencing their beliefs and the typical dietary intake for 2 to 5-year-olds. Interestingly enough, at that study, we found too few studies to even discuss the relationship between TV advertising and teens' health. There was just insufficient research at that time. Remember when we were doing the study and doing a retrospective, going back at least 20 years to look at the literature, TV advertising was the primary source of food marketing to children. Next slide, please. Nonetheless, that report made some very strong recommendations. It concluded that indeed food and beverage marketing was an influential factor in the diets and health of children, that the kinds of food and marketing practices were out of balance with healthful diets for children, and some suggestions that it was putting our children's health at risk. And we felt that the industry and marketers were underutilizing their incredible potential to devote their creativity and resources to develop and promote foods and beverages and meals that supported healthful diets. Next slide. We understood that achieving healthful diets required a multi-sectoral, many people involved, integrated efforts between industry leadership and initiative and advocates and schools and government. Lots of people had to be involved to support a sustained integrated effort to improve both the food marketing environment, but also the sorts of environment for children's health that required healthier diets. At the time, we thought that public policy programs and incentives did not have enough support or authority to address the emerging marketing practices that influence the diets of children and youth. Next slide, please. In 2011, along with some colleagues of mine who'd been involved in the 2006 study, we conducted an evidence review to examine what kind of progress had been made since that 2006 report, which I might add, that report received a lot of publicity. Hearings were held by the Federal Trade Commission on it, and it was widely presented throughout a lot of media. We used a standard practice to locate, evaluate, assemble, and look at the decisions that were made. We categorized about 117 pieces of evidence that we gleaned from academic articles, industry and government reports, newspaper and press stories. Next slide, please. And our conclusion was that overall, the food and beverage companies had made some moderate progress between 2006 and 2011. They were trying to look at the Institute of Medicine's recommendations for improving food, and they were trying to promote a more healthful diet. Other industry subsectors, such as restaurants, trade associations, and at the time, we thought media and entertainment companies made only limited progress. The most important progress that was made by the food and beverage companies was the establishment in 2006 of the self-regulatory Children's Food and Beverage Advertising Initiative. Early on, CFBAI was criticized for having differing standards, nutritional standards across different product groups. They listened to that criticism, and by 2012, they adopted common nutritional standards that were accepted by nutritionists for what would be considered healthy foods to be marketed to children. Next slide, please. Next slide. So that while we were doing that 2011 review, the Institute of Medicine convened another study committee to look at how we could accelerate progress on obesity prevention. That study committee had the charge to review the past obesity prevention-related recommendations and to develop indicators of progress, plus recommendations for future action. The urgency of the situation was drawn because we, at that point, had not seen any leveling off of obesity rates in the United States. If anything, we saw the problem continuing to grow and felt that our progress between 2004, the original statement by the IOM about childhood obesity, and then in 2011 and 12, that not enough progress by any means had been made. And so this particular study committee was established. There actually is a documentary about the work of this committee. It was produced by HBO called Weight of America, and that documentary is still available on their website if you want to see how things unfolded over the course of the year of that study group. Next slide, please. The 2012 committee set out 5 goals, and for each goal, which I list here, they also had strategies that needed to be met and messaging mechanisms to try and ensure that the recommendations were met. The goal that I really want to talk about is the goal of marketing what matters for a healthy life. Next strategy. Next slide, please. The argument that they made was that we needed to have industry, educators, governments should act quickly, aggressively, and in a sustained manner on many levels to transform the environment that surrounds Americans with messages about physical activity, food, and nutrition. Next slide. The recommendations were fourfold: to have government in particular develop and support a sustained targeted physical activity and nutrition social marketing program. That has not come about, but there is an independent group out there, the Public Goods Project, which is attempting to start an ongoing social marketing campaign around obesity and other health issues. The second strategy is the one that I think is most relevant for today's discussion, and that is that the food, beverage, restaurant, and media industry should take broad, common, and urgent voluntary action to make substantial improvements in their marketing aimed directly at children and adolescents aged 2 to 17. The recommendation of this committee was that all foods and beverages marketed to this age group should support a diet that accords with the dietary guidelines for Americans in order to prevent obesity and risk factors associated with the chronic diseases I talked about earlier. Children and adolescents should be encouraged to avoid calories from foods that they generally overconsume. That's those foods high in sugar, fat, and sodium, and replace them with foods that they generally underconsume, such as fruits and vegetables and whole grains. The standards set for foods and beverages marketed to children and adolescents should be widely publicized by the industry. And this APOP committee recommended that they be easily available to parents and other consumers. They should cover foods and beverages marketed to children and adolescents aged 2 to 17 and should apply to a broad range of marketing practices. And here we were particularly concerned about digital marketing and the use of licensed characters and premiums such as toys and cereal boxes, and what sorts of products these particular kinds of marketing practices were being applied to. If such marketing standards have been adopted within 2 years by a substantial majority of food and beverage, restaurant, and media companies that market foods and beverages to children and adolescents, we thought that if they weren't making their way within 2 years, then the federal, local, or state governments should step in to try and encourage, and if not encourage, then set mandatory nutritional standards. So what has happened since these recommendations in 2012? Next slide, please. Well, the CSBAI has taken to heart the concern of that 2012 report, and it made a pledge that by 2014, all of the companies involved in CSBAI, which covers about 3/4 of the food and beverage advertising companies and now includes some of the quick serve restaurants, that they would pledge to only market healthier foods to children and to refrain from using media characters to promote unhealthy foods. And so, what's happened since 2014? Next slide, please. In 2017, along with some colleagues here and with funding from the National Science Foundation, I was involved in conducting a study to look at the CSBAI compliance with these pledges. And we had two particular questions we were asking. What is the scope of marketing foods to children via television, online websites, and apps? That is, what kinds of marketing is available to children today? And are the CSBAI food marketers holding to their pledge to market only healthier foods to children? The pledges were supposed to go into effect in January of 2014. We waited a full year until 2015 to begin to examine and analyze the food company marketing strategies. Next slide, please. We coded 132 television advertisements, 171 instances of marketing within food branded websites, and 43 instances of marketing within food branded apps. The websites and apps were sampled from a list of brands produced by the CSBAI companies and a matched list of non-CSBAI brands. Next slide, please. We were interested in the kinds of characters that were spokespeople on these marketing venues. We looked at licensed characters, human spokes characters, product mascots, their gender. And next slide, please. We also tried to include a measure of energy density. One of my students at the time had, she was a student at the time, she's now finished. She has a master's degree in nutritional science, and she helped us develop and suggested that we use this measure of energy density. It's a metric of how filling food items are. Foods low in energy density will cause people to feel fuller without adding calories to their diets. Therefore, foods low in energy density are considered healthier for you by nutritionists, and they should make up a larger portion of people's caloric intake. People should only rarely eat foods with an energy density of above 4, meaning that over half of the foods in our sample that we found here were for foods that were inconsistent with a healthy diet, because the median ED for the foods that we were content analyzing and examining was over 4. Next slide, please. The other thing that we noticed is that if you moved from the television marketing to the web and to the apps, increasingly the spokespeople for the foods and beverages marketed to children were mascots, not licensed characters or spokes characters. Next slide, please. And you can see that most clearly that this becomes problematic because product mascots tend to be more likely to promote more obesogenic foods. And that is definitely a problem. Next slide, please. So has the movement to curtail food marketing to youth been effective online? In short, there's some evidence of a healthier food marketing environment for children. We found the fewest websites online that we would characterize as child-oriented. In fact, we found, contrary to prior research, only 15 of our websites seem to cater to children at all among these CSBAI and non-CSBAI companies. In 2009, it was about 50%, so there seemed to be a reduction in marketing specifically for children on the websites. However, what we did find was that these existing websites now are dominated by advert games, which promote particularly unhealthy foods. And there's been a proliferation of all kinds of new techniques, even since we did this study when we collected our data in 2015, particularly the movement of marketing onto social media sites, viral marketing, and in particular this growing use of promotional activities via immersive or experiential marketing. In short, I would conclude by saying that the food and beverage advertising and marketing to children continues apace, that there has been enough discussion within the marketplace of the need for healthier foods for children. And I guess I would also say that I find in my interviews with parents, and I've been doing that for the last year around a variety of topics, that the parents of young children today, they themselves are interested in finding healthier foods for their families. So we may be at the start of turning the corner on the childhood obesity crisis. And indeed, in some places, childhood obesity has leveled off. A good example of that is in the city of Philadelphia, but there's some suggestion that it's leveling off nationally. And so perhaps in another 10 years, when we'd have a 20-year anniversary of the 2006 report, we'd have different things to say about the relationship between food marketing and children's health and development. Thank you.
Great. Thank you very, very much, Ellen, for this deep dive into today's topic. I'd love to open it up for questions. You have the chat bar at the right-hand side of your screen, and you can also send me a quick email if you would like, s.bligh@theconsumergoodsforum.com. If nothing comes to mind now, please know that I will follow up with Ellen if you do have any specific questions on her presentations or insights that you would like to hear from Ellen on the topic. Great. So I've received a first question by email, Ellen. So what are parents of young children looking for?
Well, I haven't done specific studies asking them to tell us about their interest in particular kinds of products that they're looking for, but there is an indication from work that I'm doing right now that today's parents of young children are much more engaged in trying to provide a healthy environment for their children, and that includes healthy foods. There's a movement afoot that goes along with this called parent engagement, and I've been involved primarily in doing focus groups with parents in minority communities and in low-income communities for some foundations over the last year. And I found it striking that concern about their children's health and what they're eating has been very high on the list of in these communities as well. I can't quantify for you, but my sense is that parents want to know that what they're giving their children is healthy foods. The problem with some of the poorer communities, of course, is getting enough food at all that their children will eat if they have limited money to spend on food is important. And so there's a balancing act of getting their children foods that they know they'll eat and also getting them healthy foods. And by healthy foods, they mean, they do mean fruits and vegetables and milk, and where they can find food that is considered healthy.
Great, thank you. So I've seen we have one person who've raised their hand that wanted to ask a question, so we've unmuted the phone line.
So hi, this is Zulfi Bhutta from Toronto. I found that a fascinating overview. Could you say something about how, in your experience, and particularly given the Academy's committee's recommendations, what is the best way forward? Is this a consumer awareness issue, or is there a need also for legislation or regulation for responsible marketing?
Well, I always view a dance, at least as I've looked at the history of public concerns about children and media issues. There's been a dance between regulators, industry and advocates. And when there's pressure from the regulators that they will regulate something, then industry typically responds by doing better on that topic. At least that's the way it's worked in the United States, this dance back and forth. We're now in an environment where there's less interest, as I can see, on the part of government regulatory agencies to try and pressure industry into changing their activities. So I doubt that we'll see mandatory changes in the United States, at least not in the short term. I don't know whether it will happen in the long term. But I think that in the States, at least, what might change the members of that dance act is if the public, particularly the public of parents and families, begin to ask and want better foods. And I would suggest that you take a look at your market research and the kinds of research you're doing with families to see if that's happening. My sense is that it is happening. I don't know how widespread it is, but my sense is that it is happening. And perhaps both being responsible, given past pledges, the food and beverage companies can hold to these pledges to market healthier foods and find a welcoming audience and set of consumers to buy them. And perhaps the environment will change in the absence of mandatory marketing practices or some sort of regulation. I just don't see regulation happening today, at least in the US.
Great, thank you. We have yeah, go ahead.
Hi, this is Hannah Theobald from GAIN and the Sun Business Network. Thank you for a really fascinating overview of the issue of responsible marketing to children. I'm keen to understand what advice you would have in taking such good global practice from developed markets into low and middle income countries. Thank you.
That's interesting you should mention that. There was just the New York Times just this weekend had a discussion of what's been going on in Brazil. I absolutely think that if you're going to be responsible in the United States and make a pledge to market only healthier foods to children, you have to take the same pledge when you go into other markets around the world. As I pointed out early on, obesity is a global crisis. It's not just a crisis in this country or in developed countries any longer, not if it's in 72 countries of the world that we're seeing obesity rates go up. So I think you have to, for the sake of the world's children, that we should be marketing only healthier foods to all children. Now, that doesn't mean that if you make cookies and you make candy that you're out of the business. It means marketing cookies and candies in a socially responsible way. And my best example of that is what happened on Sesame Street when one of their major characters, Cookie Monster, was still being shown in the context of a show that began to talk about healthier foods and healthier lifestyle practices with children. And his line was that cookies are a sometime thing, that they're a treat. They're not something you have all the time or the main food for a meal. So I think that there are creative ways for all kinds of product categories to market healthy foods and healthy food practices to children. And I think that should be the same in all parts of the world.
Great. Thank you. There were other comments. We've unmuted the lines of those with the hands up. Okay. Great. Thank you very, very much, everyone, for joining today. As we said, we're absolutely open here to follow up with you on any individual questions that you may have. I encourage all of you to take a look at the CGF website to find out more about the commitment that we have made as an organization. You can see here on the screen all of the ways that you can connect with us and what we're doing in health and wellness at the Consumer Goods Forum. And if you want to hear more from Ellen, she will be joining us at our upcoming Sustainable Retail Summit, which is taking place on the 2nd and 3rd of October in Montreal, and we have an expert panel from stakeholders from and beyond the industry who will be speaking about this topic and how we can accelerate action in this area. So thank you very, very much for joining us today, and if you do have any follow-up questions, please reach out to me. Thank you very much.
Thank you. Bye-bye.
Thank you, Ellen.